This episode was inspired by the confusion that our community tends to experience when differentiating between a psychiatrist and a mental health therapist. In the United States, only about 6% of psychiatrists identify as Hispanic or Latino, according to Zipia. Today, we're going to learn about psychiatry from our guest, who is a psychiatrist, the stigmas that we hear about medication, how to become a psychiatrist, and we're going to answer some questions from the community, specifically from therapists, in regards to how to collaborate with a psychiatrist and a little bit more. So let's learn about our guest. Today's guest is Dr. Vanessa Velez, who is a holistic and integrative board-certified psychiatrist, psychotherapist, and artist. And I don't know if I'm going to pronounce this right, but she graduated from Geisinger's Commonwealth School of Medicine and Hackensack Meridian Health Psychiatry Residency. She's the founder of Soul Psychiatry, a private practice that focuses on integrating mind, body, and soul for deep healing. Her mission is to help young adults and adult professionals that are struggling with depression, anxiety, and trauma, psychological, existential, and spiritual distress to find inner peace. Dr. Velez combines different modalities such as psychotherapy and medications with holistic approaches that focus on spirituality, creativity, and hope. Dr. Velez has contributed to articles to Psychiatric Times and Kevin MD. She has also made media appearances on Univision, and she has also collaborated with the American Psychiatric Association, where she has provided information on PTSD in Spanish. Dr. Velez is a Latina, born in the United States to Colombian parents. Her practice is located in California, is accepting, and she is bilingual in English and Spanish, in which we will have this episode in Spanish. Let's welcome her.
Hi, hola Adriana. Thank you for having me. I'm excited to be here.
Thank you. It's such a joy, and it's been amazing getting to know you as well through this organization experience. And so I know we have a lot to talk about because there were also some questions that therapists asked for you on our social media, but we're going to try to get through most of them. So muchas gracias. The first question that we have for you, I think it's a common one and a very helpful one to ask because we want to increase representation within all these helping professions. And so what is needed to become a psychiatrist?
So, to become a psychiatrist, you first have to become a medical doctor. So, essentially, I went to 4 years of college where we learn about chemistry, biology, physics, a whole bunch of different subjects. And then we take this large exam called the MCAT to get into medical school. So, once we take that and apply, we go to medical school and we learn about how the body works. We think about how the organs work, the lungs, the heart, the skin, the brain. And then at the end of medical school, which is 4 years, we graduate as an MD or a DO, depending on the type of medical school. We both learn the same things. One is osteopathic medicine, the other one is allopathic, but essentially you're a medical doctor. And then after 4 years of college, of med school, then we go to residency, which for psychiatry, it's 4 years. So we learn how to treat and diagnose different mental health illnesses like depression, anxiety, ADHD, OCD, addiction, bipolar, schizophrenia. And what's special about psychiatrists is that we really get to see what are the root causes of mental health illnesses. And a lot of those can be related to medical illnesses. During residency, we also treat and see children, adolescents, adults, folks in the geriatric population or our elders. And we work in different settings. We work in hospitals, emergency rooms, on the medical floor, on inpatient psychiatric units. We work at the clinic, intensive outpatient programs, partial hospitalizations. So yeah, we see and do a whole lot.
And what experiences did you have in your medical school program? And we talked about this last time, and it's like an entire resume, which is great. Can you tell us a little bit more about that experience that you particularly had?
In college, I had a lot of different experiences with mobile clinics, actually. So I was able to go to Ecuador and Peru for a week at a time and really help the people there. There was a lot of shadowing doctors and then being able to, especially Spanish speaking, helping the folks there. I was able to also go to Tanzania for 2 months and really learn about global health and how it's not about just sending doctors over to a country. It's so much about infrastructure, politics, government, sanitation, thinking about all of these different aspects of health. And then in medical school, I did a lot of different electives, month rotations at different hospitals because I really wanted to see what psychiatry was like around the country. So I went to MUSC in Charleston. I went to University of Colorado, and that was at the psychiatric emergency room. I also had rotations at UCLA and their inpatient unit. University of Washington, I did consult liaison. So you're a psychiatrist being an ambassador for psychiatry to the medical folks. So you're educating and seeing patients on medical floors. Sometimes if they after a suicide attempt or after an overdose, and so seeing those patients on the medical floors. I was fortunate to go to the University of Arizona with the Andrew Weil Center and learn about holistic approaches to medicine. And there was another rotation up in the Redwoods near Santa Cruz where we also learned about integrative medicine, thinking about Ayurvedic medicine from India, energy healing.
It sounds really cool, really exhausting too. When I think back to my time as an undergraduate student, as a graduate student, it's just very exciting to be able to finally be in your dream, right? Your career dream, and helping people using the skills that you're being taught to a community that's in need. Now, I'm wondering, as a Latina, how supportive were your parents of you choosing this career?
Fortunately, my parents were very supportive. There were moments in time where, my dad might have seen how difficult it was to get in, undergrad, college, med school, residency. So there were times where maybe he said, well, why don't you consider. But I was just pretty set on, I was like, "No, I want to be a doctor." And then in residency, I was just like, I want to be a psychiatrist. So they've definitely been just really supportive, like emotionally and spiritually, to be able to help me because I really think it takes a village. We can't do it alone. And so we need, parents and mentors to really support us through this journey.
Yeah, I think with just about any milestone, anything that we're doing in life, having people to support you is so helpful for our mental health because it harms our mental health when we don't have that support. Or, they're telling us you should become a lawyer, you'll be more successful doing this, doing that. I think some of those messages from your father were just him trying to not see you struggle, either physically or emotionally at that time, which is part of the sacrifice of attaining our careers. Unfortunately, there is a little bit of that with some of our goals sometimes. Another common question, Dr. Vanessa, that we have gotten mostly from our clients, and I don't know if you have as a psychiatrist, but as a therapist myself, is that sometimes there's some clients that come in and they call and they think that we are psychiatrists because they don't know the difference. Or perhaps they're already in treatment and they ask, when will we start talking about medicine and are you able to prescribe that? Let's talk about it. What's the difference between psychotherapists and psychiatrists?
It's definitely very confusing because they both sound similar. So, psychiatrists are medical doctors that specialize in mental health, and we're able to see those root causes of mental health. One of our tools are medications. It's not all a magic fix or a magic pill, but it's definitely one tool that can be life-saving, and depending on the severity of the mental health illness, may be needed lifelong or can be used for 6 months to a year at a time. So medications is definitely one option. We also have modalities such as electroconvulsive therapy, transmagnetic stimulation therapy for folks that are severely depressed or severely psychotic for ECT. That's very helpful. We also have new medications coming out and medicines like there's ketamine is now legal, but we also have a lot of medications in research like psilocybin, MDMA. So those new psychedelic medications are coming out into this new frontier. And then that holistic approach of looking into lifestyle and preventative psychiatry is really important. Thinking about nutrition, joyful movement, thinking about creativity and spirituality. The way I think about psychiatry is the healing of the soul. And so thinking about that hole in the soul that we try to fill with external, again, psychiatrists are medical doctors. Psychotherapist is an umbrella term for therapists. And there's so many different kinds. There's marriage and family therapists, licensed clinical social workers. There's also psychologists with PhDs and PsyDs. So different levels of education, whether it be master's or doctorate levels. Therapists, they mostly focus on therapy, and they also can do research. They think about thoughts, feelings, behaviors, see the person in addition to the society at large. So there's so many different unique perspectives that therapists bring. Psychiatrists are also therapists. We can also provide therapy. The premise is that psychiatrists were medical doctors, just like surgeons, just like pediatricians, neurologists. We just specialize in mental health, and we work, therapists and psychiatrists, we work together to help people.
I think, on the logistics end, our career tracks are very, very different in the sense that psychiatrists went to medical school, and then psychotherapists can earn a master's degree or a doctoral degree. At that point, if they earn a doctoral degree, then they would become psychologists, and still doesn't mean that psychologists can prescribe medication. The medication component is specifically for psychiatrists. Now, are there states where at the master's or doctoral level, mental health professionals are able to prescribe? I think that that's being looked at. It's been a long time. Maybe there's some states. I don't know. I'm in California. I think you're in Pennsylvania, right?
Yeah, and my medical license is in California. So my sister is actually a PsyD, and she was mentioning that there are some states that psychologists can prescribe medications. Because it's also important to note that, there is such a huge need for mental health professionals. Sometimes you might start your mental health journey with your primary care. They might prescribe you something, and then you might want to see a psychiatrist for a second opinion or just a more nuanced opinion in a state where a psychologist prescribes. They might get you started, or you might start with a therapist. And then when you and the therapist are seeing that you've done all the possible work in therapy, but you're still not feeling completely better, you can start thinking about, well, do medications have a role? Can they have a role in feeling better?
I think that the accessibility component is really important, as well as the education, access towards education about it. And so with that, let's talk about that stigma that exists with medication. Why do you think that, either from your professional or personal opinion, why there's a stigma towards medication specifically in the Latinx community?
I think there's a stigma because there's just a lack of education. We have the word like, oh, él está loco, él está loca, loquito, and it doesn't really help the stigma because there's a lack of education around these people are very ill. They're mentally ill. So just like someone who has the flu or COVID or something, we would show them compassion and love and understand that the mind and the body are connected, and that when we're mentally not feeling well, we can physically not feel well. And when we're physically not feeling well, we can mentally not feel well. So I think it's really important to understand that there are severe mental health illnesses and to really look out for the signs. So in terms of depression, it might be hard to get out of bed, or we might have feelings of hopelessness or helplessness or feeling like a burden. We might have a change in appetite, increased appetite or lower appetite. For anxiety, we might feel like fear, and we might even have panic attacks where it's hard to breathe and our palms get shaky. Our heart is beating really quickly. So that's sort of like a fear of impending doom, like I'm going to die. With bipolar, when people are going through these manic episodes, they're not sleeping for 7 or more days. They might feel like they have a bunch of energy and confidence and they're here to save the world, sort of having these grandiose ideas. They might do some impulsive things, spending a whole lot of money or being promiscuous. So it's really important to look out for the signs of psychosis, being out of touch with reality, hearing voices that might not be there. So sometimes when we might see someone on the street talking to themselves or laughing to themselves, they might be very severely ill. And so they need the help of a psychiatrist in particular to help them with medications and to connect them with resources like a therapist or a case manager. They might need to be on long acting injectables, which are medications delivered by an injection that can last for a month or more. So it's really important to look out for the signs and realize that mental health is a real thing and there are severe symptoms. I also think that, our community is very strong, and we think that we need to do it alone, and that, seeking help, especially outside of our family unit, is a measure of weakness. And so it's so important to remember that vulnerability is strength, and it's okay to ask for help. I also think that there's so much inherited trauma that we also hold. So we've been in this survival, fight, flight, freeze mode for so long. So it's been hard to feel our feelings and deal with them. Our generation in particular, we're able to care for our mental health a bit more. So yeah, there's a lot in that takes place in holding the stigma, but this is wonderful that what we're doing is educating folks.
It's necessary, and to have the information also available in Spanish, right? I wish we could have it in different dialects. That's the dream, hopefully in the future. But I think having this information available to our community in their language is really important. It's been necessary. And I think it's the reason why people in our community have been seeking more help. I grew up in the 90s, so I can compare. Since the 90s, there have been more organizations, mental health organizations, that have been founded. There has been more information, more ads, even social media, storytelling has been helpful, et cetera, et cetera. I have to agree, that in the sense there are very protective factors in collectivistic cultures like our culture that, for many times it's helpful, and then for other times it's not. I will add that the medical model that we fall part of, because we are healthcare professionals, historically has been very harmful for our community, for different communities of colors. Our communities speak with one another. There's been a lot of fear that has been validated by professionals, doctors, therapists, psychiatrists, and different industries from the healthcare perspective. When I think back to my family definitely feared going to services, asking for help, because they didn't want to feel invalidated. They would say, que hueva, like just ugh, to be going and to just experience invalidation or have to advocate for yourself over and over and over. And unfortunately, we live within a system that is very oppressive in that sense. The goal also for Latinx therapy is to debunk that, is to combat against that, is to bring awareness to therapists that are not interested in following that kind of model as well.
Thank you for bringing that up. The mistrust and the valid mistrust is so important to address, because our culture has experienced so much harm from the medical establishment, and then even before medicine, colonization and slavery and that type of oppression. And there have been studies in Puerto Rico to sterilize women from, medical community sterilizing women, and all of these different, Tuskegee and all of these different things that have happened, I think is important to bring up. And the hope is that we're building that bridge back from providers to the patients of trust.
Yeah, representation matters. It matters here. It matters everywhere. So thank you for mentioning those as well, they are in history, like they historically happened, but they continue to happen in other ways in the present as well. So the mistrust continues. With this, we talked about how bringing awareness through education is important, language accessibility, but what are other ways that we can work on the stigma? For your profession, on the stigma towards medication for mental health and for mental health in general?
I think definitely this education piece is so important, and educating therapists and different providers in mental health of like when to refer to a psychiatrist is really important. And I think in our communities and our family structures to talk about our own struggles, definitely with people that we can trust, but sort of opening up that window and testing out the waters of trust sometimes is important, because the thing that unifies us all is suffering, human suffering. We all go through moments of sadness and anxieties and fears. And so if we can just start to humanize each other and our human experience, I think is so important. We've been sold this pursuit of happiness, this beautiful American dream there, but there's also been a cost that I think it's important to remember that we all are vulnerable to life's pains. And so just bringing back that sense of love and compassion and kindness for each other is really important.
I'm going to continue to advocate for sharing our stories. The stories, there's so many elements within us, so many experiences that we've gone through. So the stories that you are comfortable with talking about, that make you feel emotionally safe when you say them out loud, that make you feel like, maybe this can help someone else out. I think that type of connection is really powerful amongst each other and amongst breaking stigmas. I'm a true believer, and I think so many people are, that we learn from one another. We're able to break cycles in that way. So when I learn how someone is going about a hardship, I think, what from that story can apply with my style, and how can I grow as well? So it could be very inspiring when we share stories, but we have to also be ready to do that. So with that, we had some questions from the community that I think were validating and great. So I'm just going to go ahead. For everyone watching, we're going to do a fire round because there were quite a few that came. So the first one from a bilingual counselor: what's the best way for a therapist to communicate and discuss treatment plans with a psychiatrist?
Yeah, so I think the best way is emailing the psychiatrist or having a phone call and just sort of expressing, any concerns that you might have about the patient, or just letting them know, a little bit of your background on working with the patient. The way I think about it is, if I'm seeing the patient just for medication management, I only have a snapshot. So, you know, you all, like the therapist, you have like a whole movie, and so together we can really create a film, and I can be filled in, you can be filled in, and there are certain things that I would want to ask you, especially about sifting through, is this depression, is this bipolar, especially because there are medications that we can prescribe that can flip people into mania without really knowing their history. So it's really important to get that history from the therapist, also from the family. But yeah, feel free to just contact the psychiatrist so that you could be on the same page about the diagnosis, the treatment plan, and just any different impressions that you might have.
Okay, that's a great lead. I know many colleagues have a little bit of anxiety when reaching out to a psychiatrist, so thank you for clarifying that. And this, of course, everybody is assuming you have the release to speak to a psychiatrist. Always, it's not just verbal consent. We need a document that the client has signed that says, you are good to go, and what you are good to go to discuss with the psychiatrist. So, for example, if they don't want you to discuss attendance, you can't talk about attendance with a psychiatrist, even if they asked. All right, next from Ruby from Changing Cycles Counseling: when should a therapist suggest medication to a client?
Great question, Ruby. So I think that when the patient has done everything like possible in therapy, and you as a therapist and the patient are kind of feeling stuck, and there might be this question of like, well, maybe something's going on, maybe this is more like biochemistry or neuroanatomy or organic, maybe it's more of a medical situation. I think it's really important to consult a psychiatrist. So we can do some lab testing to see, oh, is this possibly thyroid issues or iron deficiency or vitamin deficiencies? So once we rule out a medical cause, then we can think and consider medications, which can help the patient dive deeper into therapy, dive deeper into self-care. So I think it's a good in maybe a few months or in 6 months, when you're kind of seeing that there isn't a whole lot of progress that that could have been made in therapy, I think it warrants, a referral to psychiatry.
And Ruby does have a couple other questions. And I think for everybody, we recorded this twice because it was raining last time and the connection was just off. So I can't remember if that was here or back then. But, anyways, I think you may have mentioned that appointments are going to depend on the psychiatrist and their services. So appointments can range from like 10 minutes to a whole 50-minute, 60-minute session. Is that correct?
Yeah, so it definitely depends on the setting. So in my private practice, I really like to take my time with patients. So I offer 90 minutes for that initial consultation. And then after that, if we're doing therapy and medications, it's 50 minutes. If we're just doing therapy, we're doing, 50 minutes. Or if we're doing advanced medication management, it's 50. 25 minutes is for medication management. But in other settings, particularly in settings that are insurance based, they are pretty quick. And so
Mm-hmm.
sometimes it would be helpful to have a list of questions or concerns, kind of have your own agenda to come into the appointment, sort of organized so that you can maximize that time with the psychiatrist. So it really depends on that setting.
I agree. I've experienced that too. My clients have shared. So, with that, what cultural background questions do you ask before providing medication, if any?
Yeah, so I really like to ask patients, what are your beliefs? What are your thoughts about medications? What's sort of possibly getting in the way of feeling better? And how does culture and religion play a role in this, in these thoughts? Are these your thoughts? Are these thoughts that you've adopted from your loved ones, from society at large? So kind of teasing apart, what are your beliefs and what can help you feel better. So that cultural piece is really important, and the religious piece. And when we were talking about the stigma, having religion in our culture is really beautiful. It's given us morals and just good values, and at the same time, sometimes that can get in the way of treatment as well, because we think that like we just need to keep praying or sprinkle holy water, or we need some sort of like exorcism, and all of that, is valid. And at the same time, it's also really helpful to get the professional opinion of a psychiatrist, of a psychotherapist, to see what's really going on. So that cultural piece and the religious piece and spiritual piece is really important. Thinking about what is our purpose, our meaning, what gives us strength, and could medications be an opportunity to feel better, just like it would be like a vitamin or supplement just to nourish our brains and our bodies for a little bit of time.
Mhm. When you're referring to speaking with the psychiatrist about that religious component, the spiritual background, and all that, I think it's also helpful for our clients to ask us about that, in the sense that, do you understand my culture from that perspective? Because that's probably going to play a role. Or if the client doesn't have awareness, for us as professionals, right, to maybe bring it up. Because I think part of the medical model is kind of, we have like categories to describe clients as resistant, as defiant, if they are not adhering to treatment. But it could be a cultural barrier, right? A belief that is coming in the way, and it's not necessarily in adherence. So I think all of that plays a huge role in therapy and in any medical model. Actually, we are winding down now. Dr. Vanessa, where can people find you? Where can people learn more about you and your services?
My practice is called Soul Psychiatry, so you can find me at my website, vanessavelezmd.com. I offer services to patients that are in California, and so you can feel free to request an appointment. I offer 20-minute free consultation calls, and then we can book our first initial appointment. You can also find me on LinkedIn, Vanessa Velez, MD. Instagram, my handle's here, Vanessa Velez, MD Art. I'm also an artist, so you can find my artwork on Instagram and on my website.
Amazing. Thank you so much. All right, everybody. Dr. Vanessa Velez also shared a couple resources, so I'm going to connect that in the descriptions and the show notes. Dr. Vanessa, thank you so much. It has been a joy and a pleasure getting to know more about your background and about the psychiatry world. I appreciate you. Gracias.
Gracias, Adriana. Thank you.
Nos vemos, everyone.